This morning, another precious life slipped away. A man who just yesterday seemed perfectly healthy is now gone forever. It happened without warning. That's why I want to ask you something personal. Have you noticed anything unusual in your body lately? Digestive discomfort that won't go away? Back pain that comes and goes? A kind of fatigue that feels heavier than usual? You might have brushed it off as stress or aging. But in my 40 years of practice, I've learned something important. Sometimes it's the small things we ignore that give us the best chance to catch a problem early. There's one question I've been asked too many times. Doctor, if I had come in sooner, could I have survived? That question never gets easier to hear. And it's especially painful because too often the answer is yes. Let me give you just one example. In the United States, around 30,000 people die from colon cancer every year. And here's the heartbreaking part. More than 60% of those cases are diagnosed too late, when the cancer has already spread and treatment becomes far more difficult. Most people didn't even know something was wrong until it was almost too late. But there is hope, because in nearly every case I've seen, the body gave off certain signals. Quiet, subtle changes that something wasn't quite right. And if we can learn to recognize those gentle warnings, we have a real chance to step in early and stop the disease before it takes what matters most. In this video, I'll walk you through 5 early signs of colon cancer, starting with a small change you might already notice, and ending with the most serious one you shouldn't ignore. Please stay with me until the end, because I'll also show you the most effective tests that can find colon cancer early, before it becomes serious. If you recognize 2 or more of these signals in yourself, don't wait. Talk to your doctor. It could make all the difference. And if you'd like to help others stay informed and protected, please like this video, share it, and hit subscribe. It truly could save a life. So now let's start with number 5, a sudden change in bathroom habits. As we age, many things in our bodies begin to shift, and some of those changes are easy to overlook. Slightly slower digestion, a few days of constipation, or the occasional urgency to use the bathroom. These things might not seem unusual, especially when life gets busy or your routine changes. It's easy to chalk them up to stress, a different meal, or just part of getting older. But when those patterns don't go away, when your bathroom habits no longer feel normal and discomfort or irregularity becomes a regular part of your day, that's when it's worth pausing and paying closer attention. Whether it's being constipated more often than usual or needing to use the bathroom more frequently, these small shifts may not seem like a big deal, but they can sometimes be early signals that something deeper is going on. And while many things can affect digestion, one thing we've learned over time is this. Unexplained, ongoing changes in bowel habits are often one of the first signs of colon cancer. In fact, when looking back, nearly 4 in 10 people who were eventually diagnosed remembered these exact symptoms. They just didn't think much of them at the time. They assumed it would pass, like it always had. That's why this matters. It's not about fear. It's about awareness. If something in your daily rhythm has changed and it hasn't gone back to normal after a couple of weeks, that's your chance to act. Ask questions. Talk to your doctor. Take care of yourself before it becomes something more serious. Because when it comes to your health, noticing small changes early can make all the difference. Now let's move on to number 4, a sign many people ignore, but it could point to a serious issue inside your colon. Thin, narrow, or ribbon-like stools. There are parts of our health we don't often talk about, and bowel movements are certainly one of them. It's not the most comfortable topic, and many people would rather not give it much thought. But sometimes what happens in the bathroom can quietly reveal what's happening deep inside your body. One change worth noticing is the shape of your stool. If it starts to appear thinner than usual, almost flat, narrow, or ribbon-like, and it stays that way for more than a week or 2, it's not something to ignore. While there could be a number of harmless reasons, This shift can sometimes be the result of something taking up space inside the colon. That something might be a benign polyp, or in some cases, it could be the early development of a tumor that's narrowing the passage from the inside out. The tricky part is, you might not feel sick, you might not be in pain, and because of that, it's easy to think it's not a big deal. Just one of those things that comes and goes. But research has shown that this kind of change is actually one of the most commonly remembered early signs among people who are later diagnosed with colon cancer. Not because it's dramatic or scary, but precisely because it's subtle and so easy to miss. That's why it's worth bringing up. A simple conversation with your doctor, a basic exam or test, could give you peace of mind or catch something early when it's most treatable. Another important signal to watch for is number 3, anemia without a clear cause. You're eating regularly. You haven't made any big changes to your diet, but at your last checkup, your doctor mentioned something unexpected. Your iron levels are low, you're anemic, and there's no obvious explanation. Unexplained anemia like this can sometimes be an early clue that something deeper is happening, including the early stages of colon cancer. The reason is simple, though not always easy to detect. When small polyps or tumors begin to form inside the colon, they can slowly bleed. It's not the kind of bleeding you'd necessarily see or feel. No pain, no alarming symptoms, just a small, steady loss over time. Enough to reduce the number of red blood cells your body relies on to carry oxygen. You may find yourself getting tired more easily than before. Climbing the stairs feels harder than it used to. Sometimes standing up too quickly makes you lightheaded. Your skin looks a little paler, and even a short walk can leave your heart racing more than it should. None of it feels urgent, and that's exactly why it's so easy to ignore and so important to pay attention. In older adults especially, anemia without an obvious cause often prompts doctors to look more closely at the colon. A simple test, like a blood panel or a stool test, may be enough to guide the next steps. And if something is going on, catching it early can make all the difference. So if you've been told your iron is low, or you've just been feeling more worn out than usual, it's worth asking your doctor about it. Sometimes the smallest signals are the ones we most need to listen to. The next one is number 2, a sign that many people blame on getting older, but it could be something much more serious. Unexplained weight loss. Your eating habits haven't changed. You're still enjoying the same meals, keeping the same routines. You're not trying to lose weight, not following a new diet, and certainly not cutting calories on purpose. But slowly, almost without noticing, the number on the scale keeps dropping. At first, it's easy to dismiss. Clothes feel a little looser, maybe someone comments that you've slimmed down. You assume it's nothing, just one of those fluctuations that happen with age. But when that weight keeps coming off without reason, that's when it becomes something worth paying attention to. In the early stages, colon cancer can interfere with digestion and trigger low-grade inflammation, which affects how your body absorbs nutrients and uses energy. As a result, you may experience steady, unintentional weight loss, without pain, without feeling sick, and without any obvious reason. Life goes on, but with a little less energy and a little less weight than before. Doctors see this all the time. A patient comes in for a routine visit, not because they're worried, but just for a checkup. And when asked how things have been going lately, they stop for a second and realize they haven't really thought about it. Then they mention that they've dropped a few pounds. Nothing alarming. That kind of quiet, gradual loss can be easy to overlook. But it's often one of the earliest signs that something deeper may be happening in the body. If you've noticed weight coming off without trying, even if it feels minor, don't brush it aside. It may be harmless, but it could also be your body's way of signaling that it's time to take a closer look. Because the earlier you catch a change like this, the more power you have to do something about it before it becomes something serious. And finally, the first and most serious sign, the one you simply can't afford to overlook: blood in the stool. Out of all the signs we've talked about, this is the one I hope you never ignore. If you notice blood, whether it's on the toilet paper, in the bowl, or mixed in with your stool, it's time to call your doctor. Many people assume it's just hemorrhoids. And yes, that's often the case. But the truth is, blood should never be brushed aside. It's a sign that something is going on, and it's worth finding out what. If the blood is bright red, it may be coming from the lower part of the colon or rectum. If it's darker, or if your stool looks black and sticky, the bleeding could be happening higher up in your digestive tract. Either way, it's a red flag that needs attention. Sometimes small tumors in the colon can bleed slowly over time. You might not notice anything at first, but eventually that bleeding can show up. And when it does, it's not something to put off. I know this isn't easy to talk about. It feels personal, and for many it feels embarrassing. But please know, your doctor has seen this before, and they want to help. Getting it checked doesn't mean something is wrong. It just means you care enough to stay ahead of anything that could be. Because here's the truth. When colon cancer is caught early, it's treatable. But when it's ignored, it can grow quietly. And by the time symptoms get worse, options may be limited. So don't wait. If you ever see blood, even just once, get it checked. It might be nothing, but if it's something, you'll be glad you caught it early. So now here's the most important part. Knowing the signs is powerful, but taking action, that's what truly protects you. There are a few simple tests that can catch colon cancer early before it becomes dangerous. And the good news is, none of them are as scary or difficult as they sound. First, the at-home stool tests. These are one of the easiest ways to begin. Tests like the FIT test or Cologuard look for hidden traces of blood or abnormal cells in your stool, long before you'd notice anything yourself. You can do them in the privacy of your home, and many insurance plans cover them fully for adults over 60. No clinic visits, no fuss, just a small action that can give you peace of mind. Second, a simple blood test. Your doctor can check for signs of anemia or other hidden changes in your body. It takes just a few minutes, but it can reveal a lot, especially when it's paired with your symptoms and medical history. And third, the colonoscopy. Yes, it's more involved, and yes, it's not anyone's idea of fun, but it's still the most accurate way to see what's going on inside your colon. If your doctor recommends one, don't let fear hold you back. One day of preparation could give you years of protection. And if you're wondering how to lower your risk of colon cancer in everyday life, it really comes down to a few key habits that build over time. It starts with food, a diet rich in fiber, vegetables, fruits, legumes, whole grains, helps the colon do what it was meant to do. Keep things moving smoothly without strain or buildup. Staying hydrated supports that process, keeping everything flowing and reducing the chances of constipation, which can irritate the colon over time. Movement matters too. Even a short daily walk or gentle stretching can improve circulation and digestion, both important for gut health. And while it's not always easy, cutting back on red or processed meats and limiting alcohol or tobacco gives your body less to fight against. But above all, the most important thing you can do is simply pay attention. Don't ignore the small changes. Don't put off your screenings. Even when you feel fine, regular testing is one of the most powerful tools we have, because when colon cancer is caught early, it's far more treatable. Prevention doesn't happen all at once. It's a quiet commitment. Small, steady steps that add up to something stronger. Not out of fear, but from awareness and the calm confidence that you're taking care of what matters. With age come many changes, and sometimes it becomes easy to brush things off. A little fatigue, some stomach discomfort, changes in digestion. All things we learn to live with, telling ourselves it's just part of getting older. And most of the time, that might be true, but not always. Colon cancer is one of those conditions that doesn't shout in the beginning. It doesn't bring unbearable pain or dramatic symptoms right away. Instead, it often begins quietly with small shifts in your daily routine. A bit more tiredness than usual, a change in your bathroom habits, or something in your body that just doesn't feel quite right anymore. The truth is, your body is doing its best to keep you well. And when something starts to go wrong, it often gives small hints, not to scare you, but to give you a chance to act. And the earlier you act, the more options you have. That's not meant to frighten you, it's meant to empower you. Over the years, I've seen so many people wait too long, not because they didn't care, but because they didn't realize how important those early signs could be. And I've also seen what happens when someone catches it early. Treatment works, recovery is possible, and life goes on with family, friends, and all the things that matter most. So I'm asking you, if something feels off, no matter how small, talk to your doctor. Bring it up. Ask the question. It might be nothing, but it's always better to check than to miss something important. If you found this video helpful, share it with someone close to you. You never know whose life it might touch. And if you haven't yet, consider subscribing. It helps more people get the message they might really need to hear. And let me know in the comments. Have you noticed any of these symptoms in yourself? Until next time, take care. Wishing you good health, calm mornings, and the comfort of staying one step ahead.